Yes, everybody can see the presentation now. Yes. Okay. So everybody can see the presentation.
Yes.
Okay.
Yes,
So
sir. Yes, sir.
last time we were discussing about the types of belly fat. Okay. So there were we discussed about a sagging belly fat and protruding belly fat. Okay. So we will be again just to revise you. Okay. Somebody is joining now. Okay. So sagging belly fat. Brushali, do you remember why sagging belly fat happens? Why it happens? Sagging belly fat.
No, sir. I didn't revise the lecture.
Dr. Dietitian Shilpa remembers why the sagging belly fat repair. You see somebody, people are like a bag, like a bag, it is hanging belly fats are there. Okay, why it happens? What is the main reason for it? Remember?
Sir, a fat deposition.
Fat deposition is there everywhere. It's all belly fat due to but what is the specific reason for sagging belly fat? There are three types of belly fats are there. For example, sagging belly fat means which is belly is hanging, okay, like a bag. Protruding means it is like, there are people who are very thin. It is like thin people, but it is like a belly fat is emerging like that. Okay, so why sagging belly fat happens? Do you remember? Okay, Abhirami, you saw the lecture. Why saggy belly fat happens when the stomach is like a bag hanging stomach?
So
Why?
maybe due to visceral fat deposition
Yeah,
inside the organs.
yeah. This is due to the visceral fat deposits, and one of the main reasons for the visceral fat deposit is what? What is visceral fat? What is this? What is the meaning of it? Can you tell me?
Fat stored inside the organs.
Absolutely. So these are the fats which are stored inside the organs. Okay, Brushali, clear now? Okay, so mostly
Yes,
you'll
sir.
find mostly this kind of belly fat will happen in the people who have got why it happens. Remember why it happens? Visceral fat mostly. Abhirami, remember why it happens? What is the reason of it? The most common reason.
Stress and increase in weight.
It can be stress. Sometimes it can be also some issues with this metabolism. When you have a lot of less sleep or the cortisol is very high. Okay, when you can find a lot of this kind of fat in the vegetarian people population where the very less vitamin D. You remember vitamin D deficiency can increase the weight or decrease the weight. What do you think, Dr. Suman? What do you think? Vitamin D deficiency will decrease or increase the weight?
Increase, sir.
Increase the weight, and mostly cortisol level will be increased. Okay, and also one of the reason for this, one of the reason for this fat is what? Everybody knows what is gluconeogenesis. Suman, you remember what is gluconeogenesis? Yes. Ankit, you remember what is gluconeogenesis?
Yes, sir. Yes, sir.
Just revise it.
The gluconeogenesis is when body break the amino acid to convert the glucose.
Yeah, it can be amino acid also. It can be other factors.
Can be glycogen also.
Yeah,
non-carbohydrates.
So one of the main reason is this, when this kind of fat is happening due to the gluconeogenesis. Okay, that is what your body amino acids or proteins or other macronutrients can be converted into glucose, and as a whole you are increasing the sugar level and it is converted into fat. Okay, so this is also dangerous. Yes, why it is dangerous? Visceral fat or this sagging belly fat. Dietitian Vidhi, why you think this sagging belly fat is very dangerous? What is the why it is so bad? Can you tell us? You remember last time I explained. Are you here, Vidhi? Yeah. Why it is so dangerous? This kind of belly fat, sagging belly fat.
Just a minute.
Okay, no problem. I think you're Abhirami wants to tell. Yeah, why it is so dangerous?
Because it may induce cardiovascular diseases.
It can create cardiovascular diseases or other metabolic syndrome. Why? Because your whole organs can be with your organs can be with the fat. Okay, and this is one of the main reason for you can have a lot of high cholesterol and also heart attacks, all these things. Okay, these are all in pancreas. You can get fat, heart you can get fat, and this can be causing this cardiovascular disease, and of course it will cause some insulin resistance also. Okay, so what are the symptoms of insulin resistance? We have already discussed last time. I think, can you tell 5 symptoms of insulin resistance? After wants to tell, or Atharva, Dr. Atharva, tell us 5 symptoms of insulin resistance.
Sir, constant hunger,
Yes.
uh, fat deposition,
Yeah, fat deposition. And another thing,
insomnia,
insomnia can happen. Yes. One of the major thing, what it can give rise to? One of the major
cravings,
can happen. Constant hunger, craving can happen. One more thing. One of the reason for insulin resistance, very important. What is this? Dr. Suman remembers, or dietitian Shilpa remembers. What are one of the more important factors of insulin resistance? One of the more important symptoms of insulin resistance. Can you tell us? Belly fat.
Sir,
Belly fat is one of the common symptoms.
Fatty liver.
Fatty liver can happen, high cholesterol can happen, okay, and it can give rise to some dark folds. Cysts can polycystic ovary disease can also happen with the insulin resistance. Thyroid issues, okay, like frequent urination, frequent like after eating you get very sleepy, okay, slow metabolism. Sometimes memory problem, dementia can happen. People lose their memory also, okay. Sometimes mood swings, okay, can't absorb the nutrients, so you are getting less muscle mass, and also hormonal imbalance happens, okay. So all these things can happen. Fatty liver, diabetes, all these things are of insulin resistance symptoms are there, okay. So this is one of the reason your belly fat may increase also. And another thing that you have to understand, last time also we discussed about the protruding. Why protruding happens? Nitish, you remember? I think you joined the lecture last time. Yeah. So what is the main reason for protruding belly fat? When the belly fat is coming, a person may be very thin, very high tummy, big tummy like that. You can feel a lot of.
So it is also due to visceral fat.
Here, not only the visceral fat, there is another thing. Is there?
Fatty liver. Fatty liver.
One of the reason is the fatty liver. Okay, because sometimes.
Hypertension, sir.
Wait. Ankit, you remember what is toffee? You remember what is toffee? TOFI. You are not able to hear. You are not able to hear you. Okay. Brushali, wait. Please don't get over smart. Brushali wants to tell what is. Brushali, you want to ask? Tell what is toffee? It's. Remember?
no, sir.
You don't remember?
Sophie, I remember.
Okay. The dietitian Shilpa wants to tell what is toffee. It's not a toffee what you have. It's a different toffee. You remember? Vidhi,
Sir, may I try Avatav?
Avatav, tell us what is toffee.
Thin from outside, fat from inside.
Thin from outside, fat from inside. A lot of people you can see, they look very thin. Okay. And sometimes you cannot, and you can see there is a fat is there from inside. You can see a lot of people are so thin, and so also they are getting cardiovascular disease. It happens, okay, because you cannot find out this guy. There are a lot of people. It doesn't mean that a person is thin, he cannot get a cardiovascular system, because cardiovascular diseases. Because from inside there will be fat. That is one of the reason you can see that these are very toffee. It means inside. So that is the reason when you are doing BMI checking, you have to see how much fat percentage is there. Okay, that is also one thing. And protruding fat mostly happens due to the fact that when you are having a lot of fatty liver issues are there, and it is very common. And nowadays, what I see every day, I'm getting 1 or 2 clients with fatty liver. Somebody is having GPT so high around 80. Somebody is in the fibrosis stage. Somebody is in the fatty liver 3rd grade, and somebody is going for transplantation. And people after transplantation are also coming, because this kind of fatty liver give rise to mostly. Yesterday, 2 persons from Punjab came. Both of them were very. One was taking around 17 roti per day. You can understand what happened with this chapati roti. You can understand. Okay, so it turns into fat only. And one person from Gujarat came. He also having lot of khichdi, lot of bhakri, lot of this what's called rusk. All these are carbohydrates, and he has already his liver has been transplanted. He paid around 50 lakhs for the operation. You can understand this is so dangerous. Now he came just to maintain his health, so they don't get his issue again. Okay, so fatty liver are very important. Same thing, they have all protruding belly fat. You cannot tell also for looking at a person that is having this fatty liver. Okay, because there was one symptom was only there, only belly fat was there like this. Okay, so that is the reason fatty liver has to be taken very seriously. Okay, and there are many symptoms of fatty livers are there. Anyone knows any symptoms of fatty liver? Dietitian Shilpa wants to tell what are the symptoms of fatty liver. Ankit wants to tell what are the symptoms of fatty liver. What can it give rise to? Remember, Dr. Atharva? Yeah, Ankit, please try. What are the symptoms of fatty liver?
Fatty livers are lots of insulin spike. Insulin spike is the major issue. Then it can become a fatty liver cases.
Yeah, insulin spike can be there, and there are one more thing fatty liver can give us. Okay, there will be another thing in the fatty liver which we will find out in many cases. Abhirami, remember what is the main one of the reason fatty liver can give rise to?
Belly fat.
A lot of fluid retention. You will see the person will have fluid retention in the body. That is one of the symptoms. In the lax fluids can become, and all these fatty liver fluids are being, it is in the belly fat. There will be like it will very protruding fat. There are all fluid retention will be there. Okay, and also in this fatty liver, what are the consequences of fatty liver? The dangerous consequences. One of the reason is this fatty liver can give rise to. Atharva, do you remember which disease it can give rise to? Apart from belly fat, what consequences can give rise to fatty liver? Remember?
No, sir.
Dr. Dietitian Vedi remembers what diseases fatty liver can give rise to?
Diabetes.
Diabetes is very common in fatty liver. One more disease which is very common.
High blood pressure, sir.
Yeah,
Sir, thyroid.
Thyroid. Why thyroid? Why do you think Abhirami thyroid?
No, sir, I didn't tell thyroid.
Sir, Tina.
Tina told thyroid. Yes, I don't see Tina. Okay, Tina, why you think thyroid can? Why it can give rise to thyroid issue? Why? What is the mechanism? Any idea?
No, sir.
So
Because in the liver, the T3 is synthesized.
that in the liver, T4 is converted into T3. Okay, that is one of the reasons that fatty liver can give rise to hypothyroidism also, and also fatty liver can give rise to, there are other things you can see, black patches in the face or in the other part of the body. Okay, this is also one of the fatty liver's symptoms. Also, sometimes it can give rise to a lot of rashes, allergy also. Liver is detoxifying. It is not able to work properly. Okay, and sometimes the person will have lose the appetite also. Enzymatic formation will not be there. At the same time, you will be person will be deprived of proteins. Okay, protein absorption will be not happening because a lot of enzymes will not be working properly. There is a reason. There are a lot of things you will find in the fatty liver. Okay, so early symptoms you can see that the person will have. You can check in blood report also. Okay, in blood report, what you are looking at the blood report to identify the fatty liver. You remember? I think I have told earlier also. Anyone remembers what you see in the blood report? That is, Shilpa, remember fatty liver? What is the what kind of parameters you can check in the blood report? Abhiram, you remember what do you see in the blood reports?
Sir, creatinine.
No, not creatinine. Fatty liver is not a creatinine issue. Fatty liver is creatinine is for your kidney issues.
Kidney function.
Yeah, Roshni ji, आप बता सकते हैं why you are requiring?
Sir, butyrates.
Wait. Don't jump like that. Roshni ji, you want to tell what blood report you can, what things you can find in a blood report? Remembers? Ankit, you remember? What do you find in a blood report to see the fatty liver is there or not?
Can I try?
Who wants to try?
Sir, cholesterol. High
Sir,
cholesterol.
Tina.
Wait.
High
Cholesterol is not like that. Tina, can you tell us?
Sir, high cholesterol.
Sir, is it HbA1c?
No. HbA1c it is for
Sugar.
Wait. Somebody
Insulin.
wants to. No. Sabah, dietitian Sabah Jahir, you have raised your hand. Tell us how do you find out in fatty liver? What are the symptoms? What are the in blood report?
So AGOT and AGPT.
Yeah, can you tell the full form of it? Can you tell the full form? What is this? It's SGOT, okay, and HGPT. Okay, so what are these? Vidhi, Dr. Vacation Vidhi, do you know what are these?
Yes, these are liver enzymes.
These are what does it name of the enzymes? These are transaminase. Okay, so that is serum transaminase. So if you want to see the fatty liver person in the risk, you have to see the blood report, and you can see it will be higher. Generally, up to 38 to 35, it is normal. Okay, HGPT and HGMT, it is called. Okay, so that is the reason. If the HGPT, HGOT is higher, means the person is having the liver enzymes, transaminase, serum transaminases are very high. So this is one of the reasons your person is having fatty liver. Okay, and also sometimes this fatty liver can give rise to a lot of toxications in our body. Means what are the symptoms of toxications? Toxication means something toxin is there in our body. What are the symptoms of toxications? Ankit, can you tell us? What are the symptoms of toxications? Who wants to? Dr. Vidhi, dietitian Vidhi wants to tell what are symptoms of toxications?
The puffy eyes.
Headache, insomnia, headache, nausea.
One of the important is the headache, insomnia. Then there will be feeling of the person will not be able to eat properly. There may be vomiting. All these things can happen. Pain in a head. All these things. Okay, so there is a reason. Yeah, so there is a reason. So fatty liver, which is in India around 68 to around 70%, 68% population have the potential to develop these fatty livers. Okay, so that is the reason. One of the things you can add in the fatty liver is around to overcome the cirrhosis. Vitamin E is very important. Okay, vitamin E is very important. Tropotrinol, which is at least you have to give her 800 international unit per day. Also, green vegetables are very important, especially cruciferous vegetables. Okay, for these fatty liver issues and protruding fat also. Okay, so and also this you have to balance the microbiome. Microbiome, why? Because microbiome can also reduce the why microbiome is important in fatty liver. What is the science behind it? Saba Zahir Khan, can you tell us? Dietitian Saba.
Sir, Avataf, may I?
Avataf wants to tell. Okay, Avataf, tell us. What do you want to? Why fatty liver is so important? Sorry, why
Sir,
it is?
Microbiome eats fiber
Yeah.
in human body,
Okay.
and because human the fiber could not be able to absorb in human body, so microbiome is required to absorb in human
Okay.
body.
So what is the relationship with the fatty liver and microbiome? You are correct. I'm not telling you are not correct. You are correct. But what is this? How does it give the add value to the fatty liver? How to overcome the fatty liver? What is the what microbiome will do to help the fatty liver?
Sir, it's help in digestion.
It is a very simple answer. Insulin.
The detoxification.
How? It is a. The question is how. The question is how. Dr. Atharva, you wants to tell what is the reason microbiome can help us to improve the fatty liver condition? Sapora, Dr. Sapora, you want to tell?
Sir, sir, microbiome is a small chain of fatty acid.
Microzyme is not a full chain of fatty acid. Microbiome can release. It can feed on the fibers, and it can form and can release small chain fatty acids. Okay. Who told this? Meena told. Meena Nutrition, Dr. Hina told. Yes. Who told all of us?
No, sir.
Avatam. Then what will happen when small chain fatty acids will be there? What will be the next thing will happen? Dr. Safora wants to tell. Dr. Hena wants to tell.
Reduce LDL.
Wait. I'll just one person, please. 10 people will speak. I'll not allow. Who wants to speak? Please tell your name. Who wants to tell? Dr. Hena wants to tell, or Avata wants to tell, or Dr. Prema wants to tell. Dr. Prema just joined. How are you? So why, when you are having this, you are balancing your microbiome is balanced, it is giving. It is good sign for your fatty liver. Fatty liver can be healed with the help of microbiomes. Okay, why? Dr. Prema? Navisha, wait. Dr. Prema wants to tell.
Hi, doctor.
Yes,
Yeah, Dr. Prema, yes.
uh,
Yeah, please tell us. Now the question is, we are talking about the fatty liver. And in the fatty liver, what happens? One of the important part is the microbiome. Can you tell us how
Yes.
microbiome will helping you in the balancing the microbiome will helping you to recover the fatty liver?
Uh, Actually, fiber is more important in this. So glutarates released by microbes will act as a fuel for all the cells.
Mhm.
So each cell is developed means it will helpful for fatty liver patients.
It is not directly correct. Navisha wants to tell. Yeah, Navisha, give a try.
It helps in lowering insulin spike.
Okay, so this is the correct answer
So
because when how it lowers the lower the insulin spike, insulin resistance, how it will be overcoming.
small chain fatty acids.
Okay, so small chain fatty acids is released by microbiome when you are having the fibers. It's an end product, but which is very helpful for us because small chain fatty acids can be helpful to reduce the insulin resistance. In terms of when it is reducing the insulin resistance, your insulin is become much sensible and your formation of the fat will be decreased. So it can be helpful for us that microbiome can help us to improve the this condition of fatty liver. So sometimes people even don't think about microbiome and it is very important. So whenever you are creating diet plans, you have to take in account of microbiome also. Okay, of course you have to take less carbohydrate. Okay, that is one of the important in fatty liver. Also, if you are taking carbohydrate then a lot, then it will be creating problems. So how much carbohydrate you will give in fatty liver? Dietitian Shilpa, dietitian Shilpa, what do you think? How much in a day? How much carbohydrate you will give in fatty liver conditions? Think and tell. Avata wants to try. How much carbohydrate you will give?
So Dr. Hina,
Sir, 40
Wait,
to
wait.
60 grams.
Avatar is telling 40 to 60 grams. Okay, most of the time you have to restrict up to 50 grams also. Okay, so that is the reason in when you are having this in fatty liver condition for some time, for few months, 3 months, you have to be sure that you don't add a lot of carbohydrates in a diet. Okay, around 50 gram is okay. Up to 50 gram you can add it. Okay, and let us find out the third belly stage, belly fat. Two belly fat we have discussed. That is our sagging belly fat. Okay, and also protruding belly fats. Okay, and there is one of the third form of belly fat that is called our which is also superficial belly fat. Okay, superficial belly fat is seen. What are the main reasons for it? What do you think, Anabisha? Remembers why superficial belly fat happens? Atharva, Dr. Atharva wants to try. What is the reason for superficial belly fat?
Sir, estrogen derived.
No, it is mostly hormonal imbalance. Mostly it is happening when you are having hormonal imbalance. Okay. So when there are more estrogens, that is one of the reasons when there are body is having a lot of more estrogens, you will be getting this kind of hormonal imbalance and this is at result you are getting this hormonal imbalance and also estrogen dominant, which can also create this kind of belly fat. Sometimes when hormonal imbalance happen, you can find there are many diseases where you will find this kind of superficial fat. Okay, what are the diseases? Dr. Hannah wants to remind us what diseases have hormonal imbalance, which can give rise to superficial belly fat.
yeah, sir. So disease like PCOD,
PCOD, one of the hormonal
thyroid,
imbalance. Okay, or
thyroid
hypothyroidism.
disorder.
Yeah, so these all hormonal imbalance will be giving rise to this superficial fatty belly fat. Okay, and one of the thing, there are many ways because there estrogen becomes very high, so it is creating issues in our body. Okay, so from where the estrogen is coming from the body, there is a mechanism. Okay, most of the estrogens are derived from where? Atharva, you remember what are the main forms? How the estrogens are being derived in our body mostly? You remember from which?
No, sir.
Okay, estrogens are mostly derived from. Anyone wants to try? Where? Abhiram, you remember from where it is derived mostly?
Ovaries.
Not ovaries. It is derived. It has been transformed from testosterone mostly. Okay, and there is an enzyme which is transferring this from testosterone to estrogen. Dietitian Vidi remembers what is the enzyme called? Dr. Prerna remembers. Who wants to remember? Nabisha, what is the name of the enzyme called?
Aromatase.
Yeah, there is an enzyme called aromatase, which is the mostly it will be converting this testosterone into estrogens. Okay, that is one of the things that sometimes we have to restrict some products. Okay, so which are the products? There are products which are containing phytoestrogens. Okay, Bushal, remember what are the products with the phytoestrogens? For example, it's an easy question. Dr. Prema, you remember? What are the products with the phytoestrogens? Abhirami remembers? What are the products with the phytoestrogens? Yeah, there are products like soya products which are containing a lot of phytoestrogens. So when in this kind of situations, so there is a possibility that we have to restrict soya. That is a reason when you are giving soya products to them, even protein shakes will not be very bad for this kind of situation.
Sir, wheat products.
Most of the products like soya products, okay, which will be reducing, which can have the impact, which can increase the you can increase this formation of this estrogens. Okay, so that is the result. So we have to be very careful when you're having a hormonal imbalance. There are a lot of studies which show that you don't have to take a lot of soya products. Okay, that is, it increases your estrogens. Okay, and also as you saw, there is another way you can inhibit the aromatase. Okay, what you can have to inhibit the aromatase, that is to overcome this kind of superficial fat. Mostly you have to lower the way to balance optimize the level of estrogens in the body, and to overcome the this
टोकरी में देख तेरी में नीचे पड़ी है देख निकाल मेरे को दिख रही है यहाँ से
घर का बात घर में कीजिए. Don't do it here. Okay, just mute yourself and speak. Okay, so what I was telling, when you are having these estrogens, high dominance of estrogen, you are getting this superficial fat. Okay, so but aromatase is an enzyme which is converting the testosterone into this estrogen. But there is a way to block the aromatase. There is a way you can decrease the aromatase also. Okay, so what are the ways? What do you think, Abhirami? What do you think? How you can you can stop this process from estrogen? How you can do that? Which food you have to add? Nabisha remembers? You have you have to add cruciferous vegetables sometimes, and sometimes you have to add omega-3, because omega-3 can also inhibit the aromatase, which is very good opportunity for you to overcome this kind of superficial fat. Okay, so that is what we have to find out, that whenever you are having this kind of in hormonal imbalance, you have to add some food containing omega-3. What are the foods containing omega-3? You can add some flax seeds, you can add some, if the vegetarian is there, so you can add eggs, you can find, or avocado, you can find omega-3 also. In fish, you can find chia seeds, you can find, or you can take supplements. So that is one of the reason we are adding omega-3 to overcome this kind of fat, that is a belly fat in these issues like superficial fats. Okay, so let us find out how exercise is helpful for us in this, which kind of fat, what kind of exercise is helpful. Okay, so let us find out. Then in this kind of belly fats, okay, so how much the exercise will be helpful generally? Okay, how much diet will be helpful? Okay, Roshni wants to try. How effective will be the exercise? How effective will be the diet? What is the percentage?
So, Dr. Hina?
Yeah, Dr. Hina, how much you think that?
So diet 80% and exercise 20%.
Yeah, in these situations, if a lot of people will do exercise for day and night. Yesterday also I was talking with one of my clients. She was having osteoarthritis, so much of because the trainer has told to do all running in a treadmill very fast. So what happened? She got developed knee injury. So that is the reason, and there is no result also. She increased her weight. We can understand that exercise is good for us, but we have to balance the exercise. Every day you cannot do exercise. There are people who are doing everyday exercise. Belly fat is not going because the body has to recover. Ideally, exercise can be done 3 alternate days. It's a good way, and also you have to focus on the diet also. Exercise is important to improve the metabolism. It doesn't mean that you have to stop doing exercise. Exercise you can do. Mostly exercise will be done HIIT. Mostly you can do some special exercise for your for belly fat or special exercise are there. We'll discuss. And mostly the diet will be giving you mostly results. Mostly 85% of diet will be helping you. Okay, because if you are having doing exercise and you are having insulin resistance, there will be no results, because you have to activate what? Which hormone you have to activate for fat burning? Yes, remember, Atharva, what is the hormone?
Yes,
What?
sir. Somatotropin.
Yeah, you have to activate a somatotropin hormone for the activation. Otherwise, you'll be struggling. You'll be doing exercise, and there will be no effectiveness. That is the reason diet will be giving us mostly the results 85%. Also, if you are having a lot of insulin spike, a lot of people will take a lot of proteins. Okay, so that is the reason why you are taking a lot of protein also without thinking. A lot of keto diets after 1 or 2 months will fail. First month you will lose weight, fine. Next month you will stuck, weight will be stuck. Why? What is the issue with this? If you take hardcore keto diets, only proteins, it doesn't mean that you will be you losing your weight. After some time you can also stop losing your weight. Why, Dr. Hannah? What do you think? Why?
Sir, high protein diet for a long time will lead to kidney disorders like high creatinine.
This is also important, that high kidney, if you take a lot of, it can increase the uric acid kidney issue. There is another thing is there, why high protein? If you are taking a lot of protein also, the weight may get stuck. Dr. Radishan Vidi, can you give a try? Why? If lot of protein also, if you take, sometimes people keep on taking morning time protein, lunch time protein, night time protein, and after 1 month the weight is lost. After some time weight is stuck. A lot of people will find when they take a lot of shakes, like this also can happen. Why it is like that?
Sir, may I try, Avata?
Protein also again.
Let Tradition Vidi try.
Yes. Protein also gives an insulin spike.
Yeah.
Excess of protein, just like carbohydrates, excess of protein also gives rise to insulin spike, which in turn gives rise to insulin resistance.
Yeah,
And then
so
your glucose is
you are right.
converted to fat.
Yeah, so that is the
And
reason when you are taking a lot of proteins, it can also, it is giving a lesser insulin spike than carbohydrate, but still it is in a moderately high, it will increase the insulin spike. So that is the reason taking only proteins, and proteins, like people will take, a lot of people will take 5 egg whites. Okay, you can see the results will not be good. First of all, the protein will not be absorbed also. If you are taking only protein, the absorption is very low. Okay, and also it can increase the insulin level. Now the question is, what is the factors which can increase the protein absorption? Do you remember, the dietitian Shilpa? What is the
Yes, sir.
factor? What factors are there which can increase the protein absorption?
So we need to add fiber and good fats.
Fiber also, and another thing is we have to add, apart from the fiber, that is what we have to add some
Good fats.
good, and there another thing also is there. Why fiber is needed to improve the protein
Just to
absorption?
enhance the digestibility of proteins.
But how? Mechanism? You are telling every time digestibility. It's a very general answer. I want to get the mechanism. You have to go a little deeper. Who is having so much? Okay, making okay. Abhirami, I think your sound is coming from your side. Yeah. So Avatab, can you try how you can improve the this what is the mechanism? What is to be done to improve the protein absorption? Dr. Prema?
For protein, we need for protein absorption, we need to include fibers
So
in the
what
diet.
the fibers will give?
Fiber will, when fibers are there, then the microbiomes will also get active.
No, here another thing is there, not only microbiome. Who wants to try? Dietitian.
Profit.
Wait, Navisha, wait. Let us give other people also. Pavitra, you wants to try? That is,
Sir.
yeah, please.
Pavitra, sir.
Yeah, please try. Why?
Sir, fiber will activate these enzymes to produce
What are
pepsin
names
and
of enzymes?
protease.
Okay, so
Pepsin and protease.
yeah, so that is the reason. Abata, we have to understand there are enzymes are there. Pepsin is an enzyme, everybody knows. But then protease is an enzyme, everybody knows. Trypsin is a enzyme. These enzymes are important to absorb the protein. So when you are taking, if you want to have a good absorption of the protein, what you have to do? Fast, you have to take protein, or fast you have to take fibers. What do you think, Pavitra? Yes, Dr.
First, we have to take fiber, sir.
Yeah, first we can start with salads. Why not? For example, or fruits, whatever. Why not? Because then your body is already the activation. The fiber will start activating the pepsins. Because when you are taking fiber, what will happen? Our stomach will be getting enlarged a little bit, and it is the walls of the stomach cells will start creating this pepsin, which in turn will improve the absorption. Generally, protein absorption is very low. Egg white, do you remember, Pavitra, how much is the egg white has the protein absorption?
Egg white, sir.
Yeah, how much is the protein absorption there?
45%.
No, not 45%, 16%. You are telling
16,
about
okay, sir.
full egg.
Full egg, yes, sir. Yes, sir. Okay.
Rest part, where it will go? Where the
Nitrogen waste.
Yeah, it will become nitrogen waste. What is nitrogen waste? Who is answering? Pavitra answering, yes? Okay. What is nitrogen waste? Net nitrogen waste. What is this?
No, sir, I have no idea.
Sephora, Dr. Sephora remembers what is net nitrogen waste? Or Nabisha, you remember what is net nitrogen waste? Dr. Vidhi remembers what is net nitrogen waste?
So protein is converted to nitrogen.
Then what will happen? Because protein molecule contains nitrogen also. Okay, so that is the reason. After that, nitrogen can convert into fat also. Because that is the reason of most of the protein which you are not going to absorb will convert into fuel or fat. That is what you are getting. So that is the reason protein cannot be taken, randomly. And also one problem is there. Can you add 100 grams of protein one time? Dietitian Vili, what do you think? How much protein it is good to take in one meal? Up to
70 grams.
No, 70 grams is too much.
20.
Who is
20.
telling
20 grams.
20 grams, 20 to
20 grams is
25
too
grams.
less.
25 to 30, sir.
25 to 28, 30 is a good absorption of the protein. In case you are taking with good enzymes, then it will be absorbed properly. Okay, otherwise it will not be absorbed. That is the reason you have to be careful when you're taking the food and increasing how to improve the this absorption of the protein also. Okay, and as you saw that when there is a insulin resistance, of course, you will not get the good results. Okay, and also in PCOS, PCOD, we have a belly fat. One of the common symptom of PCOS, PCOD, you will be getting belly fat. It's an easy question. Vrushali wants to try why you are getting in PCOS, PCOD belly fat.
Irregular periods, sir.
No. I'm not asking why you are. What are the symptoms of PCOS, PCOD? I'm asking why you are getting belly fat in PCOS, PCOD.
Because of insulin resistance.
Insulin resistance.
It
Extra
is
carb.
Yeah, there is another thing we have. In first of all, wait. Let us ask Dr. Prema. Dr. Prema, okay. Please tell us in insulin, in PCOS, PCOD, what type of fat, what type of belly fat you see there mostly? What type? What is the type of belly fat? 3 types of belly fat we discussed. Okay, Saba, that is on Saba. What type of belly fat you see in PCOS, PCOD?
Superficial.
You are getting superficial fat because of hormone imbalance is there. So mostly you will be getting the superficial fat only. That is what, because estrogen imbalance is there. Okay, so that is the reason mostly the thyroid issue and PCOD you will get a superficial fat. So you have to, of course, to overcome this fat, you have to add what? Omega-3 you can add also. It is a good idea. And also why you are getting acne in this kind in PCOS, PCOD. Remembers, Dr. Henna remembers why you are getting acne in PCOS, PCOD acne?
Sir, excess of androgen hormone.
Why the androgen hormone will be more? What is the mechanism? Oh, somebody is opening. Okay, Abhirami remembers.
Sir, insulin increase causes lower system.
Okay, what insulin can increase what? What insulin can increase? Oh, Abhirami, I am muting you because you are in a very noisy. Not hear. I cannot hear. Okay, the Dr. Jana wants to tell what is the reason for acne. What is the mechanism? Dr. Prema wants to try. Chandra wants to try. Dietitian Chandra, why you are getting a lot of acne, facial hair in PCOS, PCOD? Hena wants to try. Dietitian Vidhi wants to try. Who wants to try?
Hi, sir.
Okay, Dr. Prema wants to try. Yes, why you are getting acne, facial hair in mostly in PCOS, PCOD?
Yes, doctor. When there is increase in luteinizing hormone,
Luteinizing hormone released from where?
pituitary gland.
It is released from pituitary gland. So what will happen if you are increasing the luteinizing hormone?
Then the levels, androgen levels, insulin, everything increases.
Where? From where? The pituitary gland will increase the or which gland will increase? Which gland will be affected, triggered? Where it will be affected?
That cells.
Where? Which cells?
Pica cells.
Where is the Tika cells?
Ovary.
Yeah, Tika cells are on the ovaries. So when you are taking a lot of insulin, the LH hormone is more, and you are getting what? The LH hormone will trigger the Tika cells in your ovary to increase more androgens. So when you are having a lot of androgens, you can get acne. When you are having a lot of androgens, you are also getting facial hair. Also, you can get it. Okay, that is the reason. One of the reason this acne can PCOS, PCOD can increase acne and facial hair also. Okay, that is one thing. So there are lots of surgeries are also there. Okay, so do you think this gastric bypass surgery or bariatric surgery, everybody knows about it? Okay, Dr. Atharva, what do you think? This kind of surgeries, you know how much this cost? 15 lakhs, 20 lakhs. These are good for us? These are helpful or not helpful?
No, sir. They are not helpful.
Yeah, initially you may feel it is helpful. I have seen a lot of people losing 60 kgs, like 70 kgs. But after some time, what happens?
Sir, hormonal imbalance.
After some time, the weight will come back, and this surgery means your stomach is like a peanut, small. But people are eating one nuts, they are eating nothing. And what happens? You are burning your fat deposits, and it is very, very difficult. I have seen this kind of patients. Sometimes they fall also. Just they have get fainted because they are so weak. Weakness happens. Okay, so that is the reason this kind of surgeries cannot be taken as a, but a lot of surgeons will tell to do the surgery because it's a very expensive surgery. But after some time, I have seen a lot of people after 2, 3, 4 years, the weight is coming back. You cannot go for second time. That is the reason. So until and unless you balance your hormones, you have the diet plan because you have to maintain the weight. Okay, that is the reason you cannot have to. This kind of surgery is not a long term. It is a short term. You are getting the after doing this gastro bypass surgery. What happens? Your stomach becomes so small that you are not eating anything. So you are eating only some like a peanut, like a pigeon you are eating. And after some time you develop weakness. After some time you lose weight, but still if the body will adapt itself. Eating more, start eating more, and the stomach will increase in size also after some time, and after 2, 3 years you can increase the weight also. Okay, so let us find out the what are the food which can increase the insulins. Okay, so these are the factors. You can see a lot of simple carbs can increase the insulins. Okay, so when you are having lot of protein also can increase the insulin, and frequent eating can increase the insulin. Okay, so why insulin is so dangerous for us? What do you think, dietitian Shilpa? Why insulin is affecting? How the insulin is affecting the whole body? We know that we eat carbohydrate, insulin is increased, or we eat a lot of protein, insulin is increased. Okay, frequent eating, and when you're eating even less fats, healthy fats, insulin can increase. So why insulin is creating all the issues in cardiovascular diseases, diabetes, then you can see these strokes, dementia. Okay, why do you think? Suman wants to try? Yes. Why do you think insulin creates all these issues? What is the reason? Dr. Roma wants to try. What is the why the insulin can create so much of issues? Avatab, dietitian VD, why do you think? What is the mechanism behind the insulin and creating cardiovascular diseases? What is the mechanism insulin can create? Of course, belly fat is there. You can create also dementia or strokes, okay, brain injuries, brain strokes, or sometimes aneurysm means your aorta will be ruptured like this, okay, fatty liver. Why?
Because insulin is like a switch. So if it is not that the glucose is not getting absorbed in the cells, so the excess glucose, then it stays in the arteries and it ruptures, causes inflammation in the arteries.
Yeah, it is, you are, okay. There is another thing is there. Okay, let us give in another way. What is glycylation? Can you tell us, dietitian Vidhi, what is glycylation? There is a term called glycylation. If you understand the glycylation, it will be easier for us. Okay, the Atharva, you remember what is glycylation? Our dietitian Shilpa, what do you mean by glycylation? Jinal, today you are not speaking, not a single. I didn't hear you.
Sir, yes, sir. I am actually outside, so
Okay, no problem. Yeah, so Suman wants to tell what is glycylation. You are a pharmacologist, PhD. What is the glycylation means? Chandra, what does the glycylation means? Glycylation, what does it mean?
can I tell Abhirami?
Yeah, Abhirami, please tell what is glycylation.
Glucose and protein combine to form a sticky compound which sticks to the walls
Okay.
of.
Okay. Yeah, I'm muting you because there are a lot of sounds are coming. So glycylation means that everybody heard about glycylated hemoglobin or glycylated sugar. Yes. What happens in glycylation? Our sugar in the blood, which is excess, will combine with proteins to create a very pathogenic sticky substance. Okay, that is very dangerous for us. That is the reason mostly diabetic people will have cardiovascular diseases, and this sticky substance will travel in the blood and it will create lot of this clottings can create. And also the dietitian Vidhi, you are also correct, it can create inflammations. Okay, then cholesterol deposit will start. There is another term called AGE. Nitish, you know what is AGE? Or Dr. Suman, what is AGE? It is related to glycylation only. With dietitian Vidhi, you know what is AGE?
No, doctor.
Okay, so anyone want to try? Dietitian Shilpa, Dr. Atharva? Okay, let me just mute everyone because there are so somebody is. AGE means it's advanced glycogen and products. Okay, so this is one of the sticky substance which is forming from the sugar and protein. Mostly you can see in glycylated hemoglobin, HbA1c, which is very high. So we are very much concerned about this. When glycylated hemoglobin is 7, 8, so it is a concern for your heart attacks, concern for your neuropathy also. And this sticky substance can create clot. And of course, this is giving rise to your cardiovascular diseases and heart attacks, and also you are getting a lot of this. Then you are having your this. Sometimes you can have all kind of heart blockage also. That is very giving rise to strokes and heart attacks. Okay, so because and another thing, your arteries will be destroyed. It will be inflammatory. Inflammation means, let's say, scratching. Okay, we will discuss in future lectures how it happens actually. Okay, so and also this inflammation can create scars in the blood endothelial layer, and it is creating fibrosis and calcium deposit starts, and ultimately you are blocking the arteries. That is it is giving rise to heart attacks also. Okay, that is one of the reason you are getting heart attacks. Okay, of course it will create retinopathy also, because when your this sticky substance, this sugar and glycolated, this glycation happens, your it will be the all capillaries of your eyes will be blocked with this substance. We are getting, that is a cataract, that is a diabetic retinopathy or cataract you are getting. Okay, so of course there are people who goes for a lot of these dining outs are also can increase the belly fat, because when you are eating outside, you are getting all kind of refined carbohydrates. Nobody is taking care of the quality of the food because you are thinking of the, there are a lot of things are added when you're eating outside, restaurants. You don't know what they're adding. One of the things is this, you're adding MSG. MSG, you know what is MSG? That is, we know what is MSG. It is very common.
Monosodium glutamate.
It is where it is added in the Chinese food. So a lot of people will take a lot of this Chinese foods, all these momos, all these kind of chow means you are getting all this MCG, which is enhancer for the food. Okay, so it is one of the things you are getting hidden sugars, and also it gives a kind of a addiction also. Okay, and these all things can create issues with your insulin resistance and increase your weight also. So okay, cheat diets are good, but not frequently. More cheat diets can give rise to you'll have all these issues with the insulin resistance, and it will increase also. Everybody remembers what is GIP hormones? Pavitra, you know what is GIP hormones? Okay, so there is another hormone, is there gastrointestinal hormone, which is also mostly released in a small intestine. Okay, so it stimulates the insulin level. So every time your GIP hormone is increased, you are increasing the insulin. So if you are having the frequent snacks, that is one of the reason we are not recommending. Snacking is good or not? Now, what do you think, dietitian Shilpa? Snacking is good. More snacks are good for us or bad for us?
No, sir, it's not good.
Why it is not good?
Because the body becomes used to and the insulin resistance.
Why insulin resistance happens? Because what is increased when you're taking lots of snacks?
The sugar and the sugar rises
It is
and
in front of you. You are having more GIP. Okay, gastrointestinal hormones are increased, and you are having. Then that is the reason it will stimulate the insulin, increase the insulin level. Okay, so that is the reason frequent eating is not good also. Okay, so let us find out to take a summary how to reduce belly fat. Number one, of course, the diet, low carb diet is important. You cannot take 200 or 600 grams of carbohydrate every day. You can restrict up to 50 to 60. Intermittent fasting also very helpful. There are some core exercises which will discuss. Fiber is okay. Then apple cider vinegar sometimes is okay. Lower the stress. It's also very important. Okay, and also good sleep. Okay. So how much carb you can give? Up to 50 gram you can give when you are having belly fat. At the same time, you have to add some other healthy fats also, like avocado or ghee, which are, if you don't find avocado, you can also add ghee also in the food, so that what is the good to add? Why to add healthy fats? What do you think, Abhirami? Why healthy fats are good to add in the meal? Why you will add healthy fats? What is the reason for it? Anyone can answer? Why you require healthy fats? Dr. Prerna?
Yes, so they don't feel hungry often to feel full satiety value.
Healthy fat will decrease the insulin spike, and a person will not be hungry. So in between the meals, okay, you will not be getting hungry. And of course, it is healthy fats are important to improve your hormonal balance also. That is the reason healthy fats can be added. Okay, and minerals. Which are the minerals which can reduce the insulin resistance? Dr. Prerna remembers what are the minerals can be added in the food which will be reducing the insulin resistance? That is in Shilpa, you remember? Who remembers? Yeah, what are the minerals can be added?
Magnesium, potassium.
Yeah, you can add magnesium, you can add potassium. Okay, you can add some vitamin, zinc, selenium. All these things are very good for us to improve the insulin resistance. Potassium is one of the very important factor. There are so many studies you can see when there is less potassium, people are more more prone to become diabetic also. Okay, and what are the foods rich in magnesium? What do you think, Dr. Atharva? What foods are containing magnesium?
Leafy vegetables.
Yeah, you can get it from mostly like leafy vegetables like almonds. Also, you can get it pumpkin seeds. Zinc and selenium, everybody knows you can get from quinoa, Brazilian nuts, or sometimes pumpkin seeds. Also, you can get it. Okay, so potassium mostly you are getting from green leafy vegetables like avocado is a high source of potassium. Tomatoes or some cabbages. All these things are having spinach, high sources of potassium. Okay, and there are some non-veg foods which are having high potassium, are like Like sometimes you can see egg also, you can see, okay, or meat also you can have some this potassium. Some other trace minerals like iodine, we can find everything in the eggs. Eggs is a good source of iodine, also iodine, selenium, zinc, copper, and some nuts are also good sources of iodine, selenium, zinc, iron also. Okay, and at the same time, vitamin B1 is very helpful to reduce the insulin level. Where you get the vitamin B1, mostly you are getting in peas, beans, in sunflower seeds also you are getting. Okay, and vitamin B12 is also very important to reduce the insulin level. So which are the sources of vitamin B12? Like eggs, like cheese, fortified almond milk, you can get it also. And when there is a less vitamin B12, you can also get, it can cause anemia also. Okay, zinc mostly you are getting from also some nuts you can get it, and selenium also you are getting mostly from pumpkin seeds, Brazil nuts, or even this in eggs, spinach, you are getting it. Okay, so why fibers are important? I hope we have discussed, because fibers can release small chain fatty acids and butyrates. Both are important for us, because for small chain fatty acids can reduce the insulin resistance. Butyrates can improve the ketosis. It acts as a fuel, okay, for us. So that also we have to take in account of fibers act as a very important factor in reducing the belly fat and insulin resistance. Okay, so we have discussed about the small chain fatty acids and butyrates also today. Sleeping is also very important to overcome the insulin resistance. Why sleeping is important? Because it is reducing the cortisol level. Okay, cortisol level is reduced. Apple cider vinegar is also good because it also helps us to reduce the this insulin resistance. And what are the exercises we will be giving? So let us find out. HIIT, everybody knows it, high intensity interval training. Chandra, you want to discuss what do you mean by HIIT?
Hello, sir. Good
Yeah,
afternoon,
what is HIIT? Can you discuss? You are also
sir.
trainer. Yeah.
HIIT is a high intensity exercise with zero rest or very less rest.
No, it is not so correct. You are telling. So anyone have a correct, better answers? It cannot be a zero rest. High intensity interval training. Yes.
Sir Pavitra.
Pavitra, tell us, what do you mean by HIIT?
Sir, we have for 30 seconds we have to run fast, and 30 seconds we have to rest, like that,
Yeah,
sir.
so there is a very there is a kind of a synchronizing factor is there. You can run 30 seconds, you can run 2 minutes, you have to rest for 1 minute or 30 seconds. Okay, then you have to again, that is the kind of a cycling. It becomes a going up and stopping and again doing exercise. Why it is so important? What you are getting? What is the use of HIIT?
The heart rate is controlled.
Which burns fat.
Okay, this is the
Fat
one of
burning,
the
sir.
features. What is the value? Yeah, who told about something about the fat
Burns
availability?
fat, sir.
Fat burning, sir.
Fat. How it burns the fat? Where it burns the fat? In your hand or in your leg? Where it will burn? Or in your stomach? Where? Which organ is affected there?
The visceral fats, sir.
Where it is?
Lungs.
Where it is? Yeah, who told lungs?
Yeah, Chandra, sir.
Yeah, Chandra, yes. Why it is mostly in the lungs the fat are burned? Because you can see,
Because
yeah, there is
80%.
yeah, all fats are moving near the lungs, then there's a sulfactant alveoli are there, it is burning there. So that is the reason you can see after the exercise, people are getting like a impression, lot of sweating in the lungs area. So that is the reason you can see that HIIT in the lungs the fats are burned. And that is the reason it is very one of the effective exercises you can add to your clients also. At the same time, there are some other exercises like that torches are also very good exercise for belly fat. Okay, you can do around four sets, like around 6 each. Okay, like 90-degree toe touch is also very good exercise. Very easy. You can do it at home also. You don't have to go to gym. Okay, that means leg is in the 90-degree. You are trying to touch the toe. Bicycle crunches are also very good. You can do at home also. You can use with your, you can support your this back part, and you can have this you can do a cycling like yeah. Okay, just let us lot of sounds are coming. Okay, I'll just mute everyone. Okay, there are other exercises also there. Let us see. Exercises are good. Once again. Okay, like dual axis tips are also very. Just mute yourself, okay, please. Okay, these types of dual exercises are also very good. It can give us a lot of strength in your abdomen. Fly hands. This is also you can support and fly with your hands and legs. Planks. Okay, planks. It is how planks are done. I hope everybody knows how Chandra planks are done. You have to you have to give a stress to your stomach belly muscles and hold it for a few seconds to minute also. Okay, planks for 40 seconds are also helpful for us. Okay, so all these things are important exercises. So you can add with the diet plan. So of course it will give us a good value also. Okay, so I think the today's lecture was having a lot of new insights and some important exercises. So now everybody is clear about what kind of belly fats are there and which belly fats why these belly fats having like sagging belly fat or protruding belly fat or even superficial belly fats, and how to reduce the belly fat. We have got very good instructions. So if you need the lectures recording, will give to you tomorrow. Okay, don't worry. Okay, thank you. I think Mrs.
Thank you, sir.
हेलो सारिका जी, नमस्ते. आपको मैंने देखा अभी ज्वाइन किया आपने.
कैसे हैं? थैंक यू.
थैंक यू वेरी मच. एंड मिसेस सारिका, आपका फोटो देख के मैं हैरान हो गया. आपने कितना लॉस किया ऑलरेडी? हाउ मच यू लॉस?
अभी सर मैं 61 केजी की हो गई.
आपका पहले कितना था? 81 केजी, 87 था ना?
स्टिल आपके डाइट पे हूँ.
थैंक यू.
लास्ट 1 साल से मैं इंसुलिन नहीं ले रही.
ओके, यू रिवर्स योर डायबिटीज आल्सो. यू रिवर्स योर डायबिटीज. वेरी गुड, वेरी गुड. अभी इंसुलिन लेना ही बंद कर दे.
सब कुछ नहीं ले रही. कोई दवाई नहीं ले रही, कोई ये नहीं. बस सारा डाइट आपका ही है जो आपने दिया है, वो 1 साल से वही यूज कर रही हूँ. और हस्बैंड का वेट भी बढ़ गया और मेरे दोनों भाई भी ठीक हैं. किसी का वेट नहीं बढ़ा.
आई एम वेरी हैप्पी.
थैंक यू वेरी मच.
नमस्ते. वेरी गुड एंड वेरी नाइस to see you. Thank you. Namaste to everyone and wish you all the best. Thank you. Thank you.
Thank you, sir.
Okay.
Thank you, sir.